Hello everybody. Today we shall discuss inclusive education in that mentally challenged children. Myself, Dr. Shivkumar Visurapur, Associate Professor and Research Guide, Department of Education, Karnataka State Akkamadevi Women's University, Vijaypura, Karnataka State. Mentally retarded children or mentally challenged children. Mental retardation refers to sub-average intellectual functioning which originates during the development period. Mental retardation is due to both heredity as well as environmental factors. Meaning and definition of mentally retarded children. The children with mental deficiency lack in mental development and possess less IQ. Their IQ is less than 75 but more than 50. IQ means intelligent quotient. Mental deficiency is characterized by inadequate intellectual functioning in adaptive, associative, and learning power at sufficient with IQ 50 to become socially adequate and occupationally competent with the help of special educational facilities. According to American Association on Mental Retardation in 1983, it has stated that mental retardation refers to significantly sub-average general intellectual functioning resulting in or associated with concurrent impairments in adaptive behavior and manifested during the developmental period. Clinical classification of mental retarded children. There are six categories of clinical type of mental retarded children. Number one, simple types. Number two, Mongolism, that is Down syndrome. Number three, microcephaly. Number four, hydrocephaly. Number five, traumatic amnesia. Number six, cretinism, that is thyroid deficiency. Classification of mentally retarded children, that is medical, educational, and psychological. How the classification of mental retarded in three modes. In medical, infections and intoxication. In educational, educable, that is they can be educable. IQ is they fall in the IQ range of IQ is 60 to 85. Psychological, there are two modes in this. Wechsler psychological, mild IQ 55 to 69. Standard Binet psychological, IQ is 50 to 67. Second one, trauma or physical agent. In educational aspect, it is called as trainable. IQ is 30 to 59. Whereas in Wechsler psychological categories, it is moderate. IQ is 40 to 54. In standard Binet psychological aspect, it is IQ between 36 to 51. Next, number three, metabolism or nutrition. These are categories: metabolism or nutrition. In educational aspect, custodial, that is IQ is below 30. In Western psychological, it is severe. IQ is between 25 to 39. In standard Binet psychological aspect, it is IQ is 22 to 30. In medical, gross brain disease, that is postnatal. So there is no category in the educational. Whereas in Western psychological, it is profound. IQ is below 25. Whereas in standard Binet psychological aspect, it is IQ below 20 to 35. Next category, unknown prenatal influence. So there are no such issues in the educational, whereas Wechsler psychological and standard Binet psychological. Next, unknown prenatal influence, chromosomal anomaly, gestational disorder. These categories doesn't have any issues, the meaning in the educational, Wechsler psychological and standard Binet psychological. Now coming to the characteristics of mentally retarded children. In general, the characteristics of mentally retarded children are classified in two categories. Number one, general characteristics and specified characteristics. Let us take first one, general characteristics. Mentally retarded child has low intelligence but his development is not adequate according to his or her mental level. Next point, mentally retarded children are of two types, that is educable, trainable, retarded and trainable mentally. IQ is 55 to 50. Trainable retarded IQ is 55 to 75 educable. Next point, mentally retarded child differs with regard to learning emotions, adjustment and physical development from normal children. Next point, mentally retarded children have poor adjustment due to several reasons, lack of motivation, feeling of insecurity. Next point, they lack in abstract, understand quickly. In that, again, inability to decide, and then B category, inability to remember, and C, lack of coordination, D, delaying development. Let us see specific characteristics of mentally retarded children. Specific features of mentally retarded children are classified into three categories. A. Educable mentally retarded, that is EMR. B1. Trainable mentally retarded, that is TMER. And custodial mentally retarded, that is CMR. Educable mentally retarded, that is EMR. I mean, it is a short form of educable mental retarded. The Iman children have IQ 50 to 75. They have normal appearance and remain unidentified until late teens. They function at an intellectual level, generally limited to learning. The most basic school subjects lack skills such as reading, spelling, writing, and numerical calculation. They are expected to learn up to the 7th standard. They can communicate effectively in everyday conversation, enjoy friendship and group social activities. They can hold or able to live independently. They I mean marry or have children. They can hold skilled. Thank you very much for watching the important aspect of mental retarded children. Thank you very much.